So thank you, everyone. Thank you, Laura. I'm Dr. David Issom, and I will today speak about holistic treatment in sickle cell disease, and by doing a quick review of non-pharmacological interventions. So myself, I'm a researcher, lecturer, and expert patient, and co-founder of the ESCF and co-president of the Swiss Sickle Cell Disease Association. So first, yes, the introduction, then some example of interventions, and then we'll discuss on the thing, and later the questions. So, so first reminder, well, you know that sickle cell disease is a very, very complex disorder, which has very negative impact on many people's life. Some issues with my computer, sorry. And it causes various complications. But the important thing here is on the left, you can see how the sickle cell disease process works. In short, you have red blood cells who will destroy themselves, who will adhere to the veins and get blocked in the blood vessels. And this causes tissue injury, hypoxia, and various complications that can be lethal and very debilitating. The hallmark is pain, as you know, and it's one of the main things we want to avoid. Also, sickle cell disease is sometimes rare, but in general neglected. In particular, in the countries where most population are affected, we know that the disease, the life expectancy is reduced by half. About in the high-income countries and in lower-income countries, most people die early. This has a huge societal cost, and despite that, the disease remains underfunded, where we know, for instance, that diseases like cystic fibrosis, which are about 400 times less prevalent than sickle cell disease, are 4 times more funded. And as a result, well, the quality of care for people with sickle cell disease is quite low, and we should address this issue. As Professor Inuza has described this morning, there are several strategies to reduce such health inequalities. Here, for instance, the US Academy of Sciences proposed to put sickle cell disease in priority, for instance, by improving newborn screening, increasing disease-specific funding, but they want to focus on what is called evidence-based and scalable interventions, for instance, using information and communication technologies, or in short, is anything that can be easily spread to a large part of population. Therefore, it needs to be robust and simple. And as an example, good example are existing treatment options we could find, for instance, in the nature. It could be herbal remedies, which we call here non-pharmacological remedies, but also all the knowledge and information that people do hold about the disease and how to better manage it. So that will be the focus today. It's important not to forget that to provide such scalable and evidence-based interventions, you need to be holistic, start from the top of society, doing policies if you need, never neglect prevention, being very comprehensive in your approaches, for instance, by doing health promotion, sport promotion, physical activity, and providing support to patients to have access to specialized healthcare providers. Also, social welfare and support groups are very important. And my main focus today will be using a patient perspective, self-care. And self-care is the individual ability to manage its own disease, or the caregiver to manage the disease of the children. Why self-care? Well, because we can act on what we do. These things we can change. Unlike our gender, our ethnicity, our family history are more, well, difficult to change. But self-care is really what you can do to have a better life and reduce symptoms, have a better quality of life. Could be taking drugs, could be changing environment, could be having a healthy diet, for instance. And it's particularly important because we know it has that self-care and individual behaviors have a great impact, very great impact on your health status. As you can see here, it's about 30% of all the health determinants, all the factors that will determine your health. And we know also that people who are unlikely to follow such health behaviors is often because they do not know what to do, nor how to do what they should do, and it leads to bad consequences such as more crises or higher mortality rate. Self-care interventions are also very important because we do them every day. We eat every day, we sleep every day, we need to control ourselves every day, we need to pay attention to various factors that could trigger a crisis every day. For instance, the infections, for instance, the weather, for instance, the fatigue. This is really an everyday task. So it makes sense that the impact on our everyday actions can change our lives. As it has been mentioned today, also it's not easy to self-care. You need to be supported. You need to keep as much as possible a positive coping attitude to life, strong mental health status, and without the support of people, it is very difficult. As well, you need to comply to medical prescriptions, for instance, or medical appointments when needed. If not, it will decrease the chances you have to be in a good health. And finally, arguably the most important, you need to conduct a healthy lifestyle, which we know it could be, for instance, having a dietetic and variety in our nutrition, drink a lot and regularly, being active, moving at least 30 minutes per day, and having an adequate quantity and quality of sleep. And if we do not succeed to do that, we have higher chances of poor quality of life. And as a human, I like food, I like good food, and good food is maybe not always the best. It could be good for your mental health, but maybe not for your physical health. And because indeed it's difficult to have such strict behaviors every day. We know also that most people actually struggle to have strict and healthy diets. We know that, as Professor Ballas has demonstrated, that only 1% of people are able to self-care properly. Manage the triggers who are manifold. It's difficult to not to be physically exhausted. It's difficult not to be fatigued. It's difficult not to have cold, to avoid infections. So hopefully we can take example on people who have succeeded to do that and follow the healthiest lifestyle. For instance, by never drinking alcohol, never smoking, never, or at least at least as possible consuming sugar. And as you will see, we are very lucky on this planet, and we have a lot of things that we can use to live better. And in particular, for people with sickle cell disease, but not only, sub-Saharan Africa has really a lot of food, of remedies, of herbs that can help us limit our symptoms. And some studies, this study in the Lancet has actually shown that sub-Saharan Africa had access to the healthiest diets in the world, so we better use it. So I will cite some of the potential herbal and natural, if you wish, remedies that could help here for anemia. Anemia is very important in symptom in sickle cell disease. If you want to reduce it so you can better grow, have better energy, and gain weight sometimes also, but also avoid decreasing your health status. And we know that studies have shown that zinc, for instance, is extremely important and helpful to decrease the crisis and other symptoms. We know it works. We know we can find it in the nature, in shellfishes, for instance, in peas, in beans. Omega-3 are also a very important lipid to help blood flow. This you can find, for instance, in fatty fishes, but you can also have, of course, complements, nutritional complements. B vitamins are extremely important to reduce anemia. For instance, when you feel that you are maybe more tired, then it may be interesting to increase in your daily diet food that are rich in B vitamins. This you can find, for instance, in liver or in yeast or in some peas also, or again, of course, in supplements like folate supplements. Glycosides, tannins, and anthraquinones are also useful and proven useful to increase our level of red blood cells. This you can find them in vanilla, for instance, in nuts like almond, in ginseng, in some berries like cherries, for instance. In grapes, there's a lot of resveratrol, for instance, in grapes that can increase this level of anemia. You have alkaloids you can find in tea, and even more in green tea, in coffee also, but in this case it's difficult, and you need to pay attention to be balanced, because we know also that coffee, for instance, can increase the dehydration. So in this case, maybe it would be more recommended to drink green tea, for instance. We have access everywhere to hibiscus flowers, hibiscus fruits, beetroots that are very useful. So as you can see, there are really a lot of things we can use in our daily life that can have a great impact, and that's what I do actually. For instance, when I feel in a lower health status, I will eat more or drink more of that. And you also starting to have now, some studies have talked about terpeno alpha, for instance. It is a herbal mix that you can find in Congo, in DRC. You can find more information on these studies of Gvolo, for instance. And it is a herbal mix of Justicia secunda and Moringa. Moringa, you can also find it everywhere, so you do not need even to have a specific mix. But the importance of such proven safe and effective mixes is that you have a dosage that you know is effective, and it avoids to be intoxicated. Because one of the main issues with all these herbal remedies and pharmacological remedies is that we do not know what are the doses, we do not know the toxicity, and therefore we need to do more studies to understand what quantity is working, what is the impact on your health, and how you can further improve your health using that. So hopefully science is going forward. So this, for instance, is now in research, also as an anti-sickler. So this decreases the risk of having your red blood cells that will get stuck in your blood vessels. You have the Pano alpha, you have cyclavit, which is also a mix of different herbs, of pigeon peat, for instance, of papaya leaves. And again, I'll emphasize that you can just eat this thing. You don't need to have the mix. You can just eat papaya. It is the same. It's just not, you do not know precisely what is the quantity, but it's still the same substance. So you will be willing to eat such things. Fagaha also is a plant we can find in the Central Africa, also a lot in Nigeria, for instance, Niprisan in Nigeria, also a lot in Cameroon. But also we have these ingredients here, for instance, in Europe, like Piper guinense, it's called West African black pepper. You can find it here. Clove, we have access to clove. You can have a tea infusion of clove. It helps, etc. Many different things we can use that are just around and cheaper than drugs and tasty, actually. So, so next for the antioxidants. Also extremely important, antioxidants, because it had decreased the sickling process. It helps oxygenate your blood, and you can do it relatively easily by using, again, such mixes like the Pano alpha, but also different plants. Like well-known are curcumin, for instance, important and actually extremely important in sickle cell disease, since we have chronic hemolysis, which means our red blood cell will destroy. We will lose minerals, vitamins, lipids. So it's important to incorporate and to increase our ingestion of such minerals like vitamin A, C, B, E, magnesium, calcium, potassium, and other omegas. Fruits are important for antioxidation, especially the fruits rich in flavonoids or resveratrols like berries and grapes. And need to emphasize also on what are called antithrombotics, which are the things that will reduce the adhesion of your red blood cells in the skin, inside the veins, and among themselves. And for that, you have omega-3 that can help. For instance, you have Seiba, Pentandra, who can also be found. And as an adjuvant, all the oxygenics, which help your body being better oxygenated, like spiruline, chlorophyll, nitric oxide. But now we have actually a pharmacological treatment for that, which is L-glutamine, has been approved 2 years ago in the US, and other actions that can be done. I will go a bit quicker because we'll just share the slides later, but there's a lot of information you can use. For instance, for pain control, cannabinoids are helpful. Vanilloids can be used as alternative aspirins. You have also herbs for infection control, garlic, clove again, basil. So this is for the herbal remedies. And now I want to focus more on more broader therapeutics, which can be mental health therapies, also proven effective. You have cognitive behavioral therapies, for instance, hypnosis, acceptance-based therapy to better accept your disease, different spiritual interventions like prayer, physical therapies, also like massages are useful, peer support groups, extremely important also, as I mentioned before, therapeutic education are also non-pharmacological interventions, and of course, digital health interventions. In the case of sickle cell disease, for now, we do not have yet proven safe and effective digital health interventions. We have a lot of gaps, actually. Most apps now are focusing on pain monitoring or medication adherence. And above all, the existing apps are lacking evidence, of course, but are designed in a way which is not very patient-centered in a radical way. It's you will have a medical provider who will have a good idea and see a problem for patients, and who will also solve the issue. from its side, from his own side. Which
you have just one more minute. Sorry.
I will conclude. Thank you. And so what I want to do to finish is to say that now the future is going towards what we call digital therapeutics, which are medical interventions that can be prescribed by doctors, and we can get inspiration from such interventions for musculoskeletal pain. You have Kaya Health, you have for substance use disorder, for cancer care, many different apps now that exist for other diseases that could be applied for sickle cell disease. And it's what we are doing actually also, for instance, in Geneva, by creating with patients tools that could that are created by patients with patients to help them do what they want to do and need to do, which is learning how to decrease the symptoms. Voila, thank you. We'll conclude by saying that today we can already use phytomedicine, herbal therapies that are proven effective. We can use digital health as a support, but we need to be together and work together to stay tight to our needs and do the solutions that will answer the needs. Not that other people do what they think is best for us. Thank you.
Thank you very much. And we will have a Q&A session whereby some people will ask you about these, especially your app that you created. We want to give a space for Miss Dianaba to give us a short experience on her for herself with using holistic treatments. Thank you.
Thank you.
Miss Dianaba, Jenna. I know she's here, but I don't know if she can hear me because she's muted. But I know she's in hospital, so.
So Laura, in the interest of time until she logs on, I can give a quick testimonial as far as nutrition or alternative and holistic approaches to dealing with my sickle cell. I so appreciate the conversation and the presentation that Dr. David just gave. Thank you so much. I really do promote and support medicine as treatment, as they say, because you know, so many of our therapies are actually rooted in some of the things that foods do and the benefits that they have, but that if you can really get it from natural sources and kind of rethink how you eat and think as food as something that's healing for your body and putting one piece in, you know, in your body at a time. You don't have to do it all overnight. It's a matter of slowly integrating one component from each category. And I love how he laid it out in different categories. I think that is so useful. And I don't want individuals who are listening to feel overwhelmed. But if you take it at a step-by-step process and just try to get one piece of food in at a time, I have actually noticed a significant change when I was a little bit more mindful at what I ate and using my food sources as healing forces. My overall frequency of my crises definitely decreased. So it helped a lot. And I didn't feel like I needed as much medication. So everyone should approach it in the way that they need to, that is best for them. But kind of taking some of the cues that he's done is really important. I think some of the other holistic therapies that we can reference and that have been talked about in other settings and other conferences include things like some of the things I talked about before, which are meditation and all that and that kind of stuff. But for some people, acupuncture is excellent. I know that there are some trials and studies going on using acupuncture and sickle cell patients, and they have seen the difference. They're trying it in 2 different settings, which I also appreciate now with the studies that are going on. They're looking at it in acute settings, but they're also looking at it for chronic pain. I have benefited from acupuncture in the past, and I use it as a part of my alternative therapy. I know for some people using baths and soaks. In my soak, I particularly use things that tend to be de-inflammatory. So I put Epsom salt, lavender, and baking soda when I do my soaks. That is very healing for me. Infrared sauna is another thing that I use I have had therapeutic, from one, heat is great for me when I don't feel well. But there have been studies that have shown that an infrared sauna can also help when it comes to inflammation and some of the things that we suffer from or have as part of our sickle cell disease sequela. So besides using nutrition, that is really a big mainstay, movement. And I referenced that in my previous talk. But as the people think of it as, oh, that's just exercise or moving, but there are actually therapeutic things that happen from it that benefit us, such as helping our red blood vessels, because we know that sickle cell disease is not just a disease of the red blood cells. Red blood cells, white blood cells, platelets, and what we call endothelial cells. And the endothelial cells are what lines our blood vessels. And we know our blood vessels get damaged, but proper movement increases oxygen to our body. It improves the blood vessels. It helps with inflammation. And it also has mood boosting. So I think putting that into your program when you can, it in itself becomes an alternative therapy. And it's really, really good. For some people who have access to it, the right type of massage. Now, you have to research, though, the type of massage that works for you. The intensity, and there are different types. There are so many different types of massages. For me, particularly, point pressure massage that goes along the trigger points in my body where I have the most pain help me the most therapeutically. And it also improves my circulation because there's a component of damage that our bodies suffer that just by doing nutrition or what we can do physically might not be enough. But when you have someone who is trained and they are then really massaging and moving that circulation and actually also helping make your muscles healthy, because we have seen studies where when our muscles get damaged and joints get damaged, there's a little bit of stickiness, which is part of our disease process where those muscle fibers stick together. Having the right massage or right hand therapy can help separate those muscle fibers and ligaments, which again improves your overall state of health. And that is excellent. I know another alternative therapy, a holistic method that some people have used is sound therapy. I don't know if anybody on the call has experience with that, but sound therapy, whether it be through bowls or the right music, there's also research and there are studies that support this that can help really kind of even out your anxiety, but improve the positive endorphins and hormones that your body can secrete and be healing in that sense. So until your other speaker, there are many more. And I know I can talk about many more, but I just wanted to give kind of an example of some that have worked for me and that have researched that I know that they're published articles that I talk to other providers about. In some instances, there are even some insurance companies that will pay for some different techniques, different alternative medicines or alternative therapies will work for different people. But the thought of being holistic and treating the whole body and being able to bring in therapeutic measures that are not medicine-based, I think for us as a community is so important because at times it almost feels like pill overload, right? We actually get pill exhaustion, and that's a real syndrome. So when we think about, okay, Dr. David referenced omegas, and omega-3s and 6s are excellent for our body. I get mine through certain foods. I take a supplement, and sometimes I take a liquid form. But sometimes the amount of pills that we have to take between the anti-inflammatory, the vitamin, because we get low in certain vitamins and we want to take a liquid vitamin, the aspirin if we're taking an aspirin, the infusion when we have to take an infusion, the pills are at a different time. We get exhausted. We get pill exhaustion. So being able to rely on natural sources, because that's what our body integrates best, and natural therapies that improves our overall health is such an amazing and wonderful opportunity to explore and just try one. And it is trial and error. Don't be overwhelmed by the options. Sometimes it can be overwhelming. But what I like to think of is I welcome it because that means I have choices. And sometimes the power lies in the options that we have and being able to try one and see if it works for us. And then if that doesn't work, try something else. There is comfort in knowing that there are options to try.